Assignments, let's talk about those. The first thing is discussion board. This says 4 discussion boards. That's not true. There's 5. There's 5 discussion board folders. Okay, and the due dates are posted in the course calendar. You will notice if you pull out your course calendar that there are different dates for your first response, your initial response, and then your responses to other people. Those are 2 different due dates so that you can read what other people are writing and respond to them and give some time for thoughtful response. I don't just want, hey, yeah, I agree, you're totally smart, I've never seen that before, good job. That's not meaningful. If someone writes about ears, then you need to say, I found this great website, or, you know, I saw bullous myringitis the other day and this is what it looked like and here's where the blister was. It was at 3 o'clock. So you need to be specific when you respond to somebody else, okay? One thing I have done in this course is the class is very large. We have a lot of you in here. So you're assigned to a group in the discussion board so that you don't have to read 25 other people's responses and respond to them. You'll just get to know your group. Your group assignment is, it says here, it's under the course information. That's not true. I changed that this time around too. It's actually in the grade book. In the grade book, so you can see course group assignment and it'll tell you what your group number is, and then you can go into communication into groups and find your group number. You can email group members, you can file exchange, all that stuff is open. So hopefully that'll help you guys out. A little less work for you guys. There are Blackboard exams. They will be open as soon as I open the folders, and they're open until the due date, at which time they will go away. I won't be turning them back on, okay? You have a set time of 2 hours each for the exams. That's plenty of time. The reason I set the time is because I don't want you coming to the exams not being prepared, flipping through your book the first time. You need to have read, make notes from your chapter on what pages. You don't have to take extensive notes, but say, you know, look, on page 205 is where the breast exam is. That way you're not flipping through your book when you take those exams. They will all be multiple choice short answer. No sharing of work. That gets you a 0. But they're going to be cool. You're going to like the exams in this class. They're going to be very applicable to what you do. You're going to have fun. Okay, what you've all been waiting for, clinical. When we put 1 hour into a class for clinical, that means you have to do 45 hours of hands-on clinical. However, I've kind of broken that down for you. You only have to do 24 hours within an actual clinical setting, okay, with a preceptor. You need to find a preceptor, and I'm going to talk to you a little bit more about what that's going to look like. You also need to do 8 hours of documented lab time with me so I can see how you're doing. However, if you live way far away, West Plains, Kansas City, whatever, and the weather's bad, I'm going to give you a pass on that. However, if I do, you have to spend 8 more hours with your clinical preceptor, and you have to let me know that you aren't coming to lab and that you will be doing time with your preceptor ahead of time, okay? And you will notice in your course calendar there are 2 dates in February that I have 12 hours reserved in the lab. Let me know 48 hours ahead of time via email whether you're coming or not to any of those lab times, what time you will be there, and how many hours you are staying, because I have to reserve beds. If I don't hear from you before 48 hours before that lab time, there will be no room for you. So you need to let me know, because we have all kinds of nursing students practicing skills and they really want those beds. So just let me know ahead of time. You can bring another student with you, you can bring someone to practice, or you can practice on me when you come to those. I will be available, and I'm going to help you. I'm going to be available during those lab times, okay? And you also get, this should say 13, not 8 hours, of clinical time that counts for your final checkoff, writing up all your stuff, and writing up your lab write-ups and your final paper. So you get 13 hours I'm giving you for that. So you come off pretty easy in this deal. Okay, you must get approval from the instructor for all of your clinical sites. I prefer you just have 1. Any more than 1 clinical site gets too chaotic and I can't keep up with that. So 1 clinical site. The sites that are acceptable are internal medicine, family practice, emergency medicine, urgent care. That would include fast track in the ER. I highly encourage you to follow a nurse, an advanced practice nurse, not a physician, an advanced practice nurse or a physician. You can follow a PA, but if you can get an NP or a clinical specialist, even better, because they're nurses and they do what you do and they know what you know, okay? To ensure a variety of assessment opportunities, no clinical specialties. No cardiac, no endocrinology. You need to be doing your time in these varied clinical areas, okay? And one thing about emergency medicine and urgent care walk-in clinics that's so great, not only do you get a variety of age, people, and diagnosis, that you also can do them on evenings and weekends. So if you work during the week, those are fabulous places for you to find some clinical time. You need to turn in your copy of your clinical agreement. You can do it a PDF or a Word, I don't care, in the assignment section, or you can email it or fax it to me, but I would prefer that it goes in the assignment section. You cannot start clinical until I have a copy of it, and it is not your preceptor's responsibility. I don't want to hear, I gave that to my preceptor, they should have turned it into you. It is your responsibility. The preceptor's doing you a favor. You get it filled out, and you send it back to me before you start clinical. If I have clinical dates noted before I ever got a preceptor agreement, I can't accept those as hours, you guys, because I need to know that you have an agreed upon area. It just gets really sticky with the Higher Learning Commission for clinical. I will also be checking in with your clinical preceptors to make sure that you are actually doing your time with them and not making that up. You might laugh, but I have had people just make up all their clinical time. And I also will be letting them know, if they need anything from me. If you need help finding a preceptor, email or call me, and I will help you if I can. I know a lot of people in the Springfield area, some out toward Rogersville, Conway. Maybe we can find you some in Bolivar, but just let me know, and I'll help you if you need help. But you guys probably already have someone in mind, which is fabulous. You're going to have so much fun. People have asked for clinical with this course for years because they really want hands-on, and you're just going to have fun. I hope everybody wants to go out and get an advanced practice degree after this course, although we're doing beginnings. Your clinical behavior and participation. You are expected to show up for arranged clinical on time. Don't show up 10 to 15 minutes late and leave an hour early because you need to pick up Susie Q at school. That's fine. I don't mind you picking her up at school. You need to do that, but you need to let your preceptor know ahead of time. I'm not staying a whole 8 hours today, and I'll be in contact with your preceptor so I'll know. Professionally dressed, so you know what that means. And wearing your SBU name tag. I've ordered everybody a name tag. They should be here soon, I hope, and then we will either mail them to you. You can pick them up at the College of Nursing. Let's see, you need to come to clinical prepared. Do not start clinical with your preceptor until you have completed all the reading in Folder 1 and Folder 2 and watch the DVD that comes with your book. Okay? Every time you go to clinical or lab, you need your text, your lab manual, and your stethoscope. Good hand washing, good nursing skills at all sites. You cannot be paid for any documented clinical hours. You cannot be on the clock. Okay? And you are not to be medically diagnosing patients or to be doing any activities or procedures other than observing and practicing assessment skills. Now, that doesn't mean I want you to stand by the wall and watch your preceptor for 8 hours. No, I want you to get in, hold a otoscope, look at eardrums, look at somebody's throat, palpate a liver. But sometimes, particularly physicians, will be confused as to what you can do. A lot of them will think you're advanced practice students and they will hand you a script pad. Do not write on that. Do not order labs. Do not give anybody an immunization. I know some of you may do that in your practice. Do not. Especially because we don't require malpractice insurance through this program. You are just learning health assessment skills. That is all you are doing. And don't do an assessment without your preceptor in the room. Please. This is a very basic class. You're just learning. You only have 24 hours. When you go on to your master's work, you will do lots of assessments without your preceptors in the room. Fabulous. But not this class, okay? I'm just trying to protect you, and that's why I'm so emphatic about this, please. The goal of clinical time is to get used to how you do an assessment, what the techniques are, how to hold an otoscope, different patient populations. So this is just a beginner course, okay? You'll have a time log of all your clinical hours. It's found in your clinical folder under the assignments. And you can do it in 8-hour days, you can do it in 4, 6, I don't care. Just make sure you have a total of 24 hours with your preceptor and 8 with me, or 32 hours total with your preceptor.